All right, let's just get right into it. This is a topic that's, well, it's surrounded by a ton of noise, right? A lot of anxiety, and honestly, some super aggressive marketing. We are talking about penile enhancement. And while it's definitely a sensitive subject, for so many men, the concern over size is a very, very real source of stress.
So today, we're going to try and cut through all that. We're going to look directly at the medical studies, the literature, and what the experts are saying to answer one big question. With all the claims and all the procedures out there, what actually works? What's dangerous? And what does the science tell us is the real issue here?
Okay, first things first. We have to acknowledge that this anxiety, it's real. It's a legitimate psychological thing that affects a huge number of men, and it often has nothing to do with their actual physical measurements.
Okay, so check this out, because this is where you start to see this massive disconnect. A survey in the Journal of Men's Health found that 85% of women are perfectly happy with their partner's penis size. That's a huge majority.
But then you flip it around and you see that nearly half of all men wish they were larger. That tells you something huge right away, doesn't it? This isn't really about pleasing a partner. It's so often about a man's own perception of himself, his own self-esteem. The problem is usually in the mind, not the body.
And you know what? There's actually a clinical name for this: small penis syndrome. And what's so important to get here is that this is not a diagnosis of a physical problem. It's all about the anxiety and the dissatisfaction a person feels, even when, from a medical perspective, everything is totally normal.
And this slide right here just lays it all out perfectly. On one side, you've got micropenis, a genuinely rare medical condition with a very specific measurable definition. And on the other side, small penis syndrome. That's the psychological concern we've been talking about, and it's way, way more common. For most men looking for enhancement, this is the actual issue. So naturally, with all this anxiety out there, a massive multi-million-dollar industry has popped up offering all kinds of solutions. So let's take a look at what they're actually selling and what's really being done.
Okay, so the most common surgery for lengthening, it's called suspensory ligament dissection. Basically, what surgeons do is they cut the ligament that kind of holds the penis up against the pubic bone. The idea is that this lets the internal part of the shaft slide forward a bit, which can make it look longer, especially when it's flaccid. And what about for making it thicker? Well, that's mostly about injections. You've got doctors taking fat from one part of your body and putting it in the penis. They also use dermal fillers. Yeah, the same kind of stuff used for cosmetic work on faces. And then you get into the really sketchy stuff like silicone gel, which is not FDA approved and can be incredibly dangerous.
And then, beyond the whole surgery thing, there's this huge market for non-surgical gadgets. You've probably seen ads for traction devices, these extenders that are supposed to stretch the penis over many months. And of course, vacuum pumps. But here's the thing you gotta know. Those pumps are medically approved for treating erectile dysfunction, which is a totally different ballgame than permanently making something bigger.
Okay, so we've seen the promises, we've seen the procedures, now for the most important part. Let's look at the actual evidence. This is where we get past the marketing hype and look at the cold, hard data on the risks, the complications, and what patients really go through.
And a huge piece of this reality check comes from a major review in the journal European Urology. Basically, these researchers dug through years and years of studies to see what was really going on, what the collective results were.
And the results? Oh boy. They are not great, to put it mildly. Just look at this table. For that ligament surgery we talked about, the average gain in length was just 1.3 centimeters. But here's the kicker. The patient satisfaction rate? Only 27%. Some guys even ended up with the exact opposite of what they wanted. It actually got shorter.
And here's the thing. This isn't some brand new discovery. We're talking about the American Urological Association, one of the top medical groups in this field. They've been saying this for decades. Their official stance, reaffirmed over and over, is that these procedures are not proven to be safe or effective.
And we're not talking about small side effects here. The risks are huge, potentially life-changing. That fat they inject, it can get absorbed all lumpy and create deformities. Scarring can actually make things shrink. And in the worst-case scenario, you could end up with erectile dysfunction, totally destroying the very function you were hoping to, enhance.
And just to really nail this down, a more recent big review from 2019 came to the exact same pretty damning conclusion. They found the outcomes were poor, satisfaction was low, and the risk of major complications was just too significant. The medical consensus here is it's overwhelming. Okay, so
If surgery and all these devices are a bad idea, where does that leave someone who's really struggling with this? Well, that brings us to what doctors and the medical community actually recommend as the first and usually the only step that's needed.
And this really is the key pivot, isn't it? The evidence is staring us in the face. Trying to fix a problem in your head with a scalpel just doesn't work. So what does?
The answer is to treat the actual condition, which, as we've established, is small penis syndrome. And you don't have to take my word for it. Authoritative sources like the Journal of Men's Health are super clear. This is a psychological issue, so it needs a psychological solution.
So what does that look like? The best approach, the gold standard, is basically a mix of education and structured counseling. First, it's about giving guys the real facts about anatomy, about what's actually in the normal range. And second, it uses therapies like CBT, or cognitive behavioral therapy, to help them challenge and reframe those negative, irrational thoughts they have about their bodies. And what kind of negative thoughts are we talking about here? This slide gives you a perfect idea. These are the deep fears that counseling helps you tackle head-on. The fear of being laughed at, the irrational belief that everyone can tell just by looking at you in your pants, that deep-seated feeling of being abnormal. It gets to the real root of the anxiety.
Now, when this gets really severe, it can actually be diagnosed as penile dysmorphic disorder. Think of it as a specific type of body dysmorphic disorder, or BDD. This is where the worry becomes a full-blown obsession and really starts to mess with your daily life. And for these individuals, surgery is seen as especially dangerous because it almost never fixes that real underlying psychological need.
So, when you pull it all together, the data, the risks, the real recommendations, what's the big takeaway? It all comes down to a fundamental shift in how you look at the problem.
The science, pretty much across the board, is telling us that for the vast majority of men, the pursuit of physical enhancement is a dead-end street, and a dangerous one at that. All the evidence points away from the operating table and points inward. It suggests that true confidence, true satisfaction, that's not found by chasing an extra centimeter. It's found by addressing the anxieties and beliefs that made that centimeter seem so incredibly important in the first place.